MSRA Practice Test 2026 Multi-Specialty Recruitment Assessment Exam Questions Prep. Question 1. A 45-year-old male presents with sudden onset of crushing chest pain radiating to his left arm. What is the most immediate first step in management? Perform a chest X-ray. Administer 300 mg aspirin and perform an ECG. Start an 4 drip. Order blood cultures. Acute coronary syndrome, ACS, requires immediate ECG and antiplatelet therapy like aspirin. Question 2. In the Professional Dilemmas, SJT, section, what is the best approach when a colleague is consistently arriving late and seems hungover? Report them to the medical board immediately. Ignore it to maintain a good relationship. Speak to them privately to express concern and discuss the impact on patient safety. Tell all other colleagues to watch them carefully. Professionalism involves addressing issues locally and supportively first, especially when patient safety might be at risk. Question 3. A woman at 32 weeks gestation presents with painless vaginal bleeding. What is the most likely diagnosis? Placental abruption, placenta previa, vasa previa, preeclampsia. Painless vaginal bleeding in late pregnancy is classically associated with placenta previa. Question 4. Which of the following is the gold standard investigation for a suspected pulmonary embolism? P. Chest X-ray, D-dimer test, CT pulmonary angiogram, CTPA, sputum culture. CTPA is the definitive imaging choice for diagnosing PE. Question 5. A 6-year-old child presents with a barking cough and inspiratory stridor. What is the most likely diagnosis? Asthma, croup, laryngotracheobronchitis, pneumonia, foreign body aspiration. Croup typically presents with a barking cough and stridor in young children. Question 6. According to the MSRA Professional Dilemmas, if you make a clinical error, what should you do first? Wait for the patient to notice and then apologize. Tell your supervisor immediately and be honest with the patient. Change the medical notes to fix the error. Quit your job. Duty of candor requires healthcare professionals to be open and honest when things go wrong. Question 7. What is the primary treatment for a patient in anaphylactic shock? Oral antihistamines, intramuscular adrenaline, epinephrine, 1:1000, inhaled salbutamol, for fluids only. Adrenaline is the life-saving treatment for anaphylaxis. Question 8. A patient presents with worst headache of my life, thunderclap headache. What is the priority investigation? MRI brain, non-contrast CT head, lumbar puncture, if CT is negative, both B and C. A thunderclap headache suggests subarachnoid hemorrhage, which requires a CT head first, followed by LP if CT is negative but clinical suspicion is high. Question 9. What is the most common cause of community-acquired pneumonia? Streptococcus pneumoniae, Legionella pneumophila, Mycoplasma pneumoniae, influenza virus. S. pneumoniae remains the most common causative organism for CAP. Question 10. In MSRA clinical problem solving, which medication class is first line for a newly diagnosed hypertensive patient of Afro-Caribbean origin under age 55? ACE inhibitor, calcium channel blocker, beta blocker, thiazide-like diuretic. NICE guidelines recommend CCBs for patients of African or Caribbean origin, regardless of age, for hypertension. Question 11. What is the triad of symptoms in normal pressure hydrocephalus? Headache, vomiting, papilledema, dementia, gait instability, urinary incontinence, tremor, rigidity, bradykinesia, fever, neck stiffness, photophobia. Often remembered as wet, wobbly, and wacky. Question 12. A patient with diabetes presents with a fruity odor on their breath and confusion. What is the most likely diagnosis? hypoglycemia, diabetic ketoacidosis, DKA, hyperosmolar hyperglycemic state, HHS, alcohol intoxication. Fruity breath, acetone, is a classic sign of DKA due to ketone production. Question 13. Which of the following is a symptom of hyperthyroidism? Weight gain, cold intolerance, heat intolerance, bradycardia. Hyperthyroidism causes increased metabolism, leading to heat intolerance and weight loss. Question 14. If a patient refuses life-saving treatment but has full mental capacity, what is the correct action? Treat them against their will. Respect their decision and document it clearly. Call the police. Consult their family to override the decision. Respecting a competent patient's right to refuse treatment is a key ethical principle, autonomy. Question 15. What is the first-line antibiotic for a non-severe urinary tract infection, UTI, in an adult female? Nitrofurantoin, gentamicin, ciprofloxacin, amoxicillin. Nitrofurantoin or trimethoprim are typically first-line for uncomplicated UTIs. Question 16. A curtain coming down over the eye describes which condition? Glaucoma, retinal detachment, cataracts, conjunctivitis. Retinal detachment often presents with a shadow or curtain in the visual field. Question 17. What is the mechanism of action of metformin? Stimulates insulin release from the pancreas, increases insulin sensitivity and decreases hepatic glucose production, blocks glucose absorption in the gut, increases glucose excretion in the urine. Metformin is a biguanide that works primarily by lowering glucose production in the liver and improving insulin sensitivity. Question 18. A patient presents with high fever, neck stiffness, and a non-blanching purpuric rash. What is the priority? Take a skin biopsy. Administer 4 antibiotics immediately, example, ceftriaxone. Wait for a lumbar puncture result. Order an ultrasound of the abdomen. Meningococcal sepsis is a medical emergency and needs urgent antibiotics. Question 19. What is the most common cause of hyperthyroidism? Graves' disease, Hashimoto's thyroiditis, toxic multinodular goiter, thyroid cancer. Graves' disease is an autoimmune condition and the leading cause of hyperthyroidism. Question 20. According to the MSRA SJT, if you witness a senior doctor being rude to a patient, you should ignore it because they are senior. Apologize to the patient and raise the issue with the senior or your supervisor. Rude to the senior back. Tell the patient to sue the doctor. Maintaining professional standards and patient dignity is a core responsibility regardless of hierarchy.